Hi there, my name is Dr. Tony Madrill, and in this 3 minutes for your mental health, I will be answering the questions, what is the difference between classic PTSD and complex PTSD, and how are they best treated in therapy? Whereas classic PTSD symptoms are a byproduct of experiencing a single traumatic event, such as a car accident, complex PTSD is a byproduct of repeated experiences of trauma over time that tend to become more intense and may negatively affect a person's development and experience in relationships. Some examples may include childhood abuse and neglect. Why does knowing this difference matter? Because the treatment of complex PTSD dramatically differs from the treatment of classical PTSD. According to the experts, complex trauma should be treated in 3 distinct phases. Phase 1 is called safety, stabilization, and skill building. And this is where the therapist will help the client create a sense of safety and emotional stability to engage in the trauma work to happen in the near future. This involves the therapist also teaching the client particular skills that the client can use to better manage or regulate their emotions. Phase 2, as noted, is called trauma processing, and this is where the therapist will lead the client in recalling traumatic memories and desensitizing to them using an evidence-based or research-based trauma treatment. Finally, phase 3 is called enhancing daily living. And this is where the therapist assists the clients with adapting to daily life in the presence of more flexible, more self-supportive beliefs about themselves and the world that were created and reinforced at the end of phase 2, the trauma processing phase of treatment. Delivering trauma treatment in these 3 phases helps clients who have a history of complex trauma work through therapy without becoming overwhelmed. It also helps the therapist identify any specific additional needs the client may have related to successfully resolving their trauma symptoms. If you would like to learn more about the best practices for treating trauma or learn about my trauma services, you are more than welcome to visit my website at www.tonymadrilltherapy.com. May you be well.